We four doctors from Dow Medical College Civil Hospital Karachi, Department of ENT and Head and Neck Surgery, Unit 2, are visiting to attend this 5th Rhinocon at Hotel Serena, Islamabad. Our today's poster presentation is regarding a very unique case, that is Sinonasal Chondromyxoid Fibroma. This Sinonasal Chondromyxoid Fibroma was also published in a journal. The author of this article was Professor Zeba Ahmed, who is the chairperson, Department of ENT and Head and Neck Surgery, Civil Hospital and Dow Medical College, Karachi. Today, Dr. Khubab Yusuf will present this case, as he has pasted this poster on the wall at Hotel Serena. Dr. Khubab is a very dynamic postgraduate student of our department, and now I will hand over my mic to Dr. Khubab, who will present this unique case.
Dr. Tariq Zaid. Assalamu alaikum everyone. My name is Dr. Khubab Yusuf. I'm a resident of Ear, Nose, Throat Department, Unit 2, Civil Hospital, Karachi, Dow University of Health Sciences. So I welcome you all, and today I'm presenting a poster over here is about the Sinonasal Chondromyxoid Fibroma. Sinonasal Chondromyxoid Fibroma is extremely a rare benign tumor that it accounts less than 1% of all primary bone tumors. For the my case report, a 4-year-old girl presented with a 1-year history of right nasal obstruction, right facial swelling, excessive lacrimation, and the disturbance in the sleep. There was no history of epistaxis, blurring, or decreased vision, restricted, and the painful eye movement. On the examination, as you can see here, there is a pinkish mass that completely filling and completely obstructing the right nasal cavity. This mass pushed the septum opposite to the left nasal cavity and completely deviated. So on the examination, I appreciate a mucoid nasal discharge in the right nasal cavity. The mass did not bleed on the probing and was not tender. The patency was totally absent on the right side and decreased on the left side. Bilateral anosmia was also noted. If we talk about the facial asymmetry, there is a prominence of the absence of the right nasolabial fold, and there is a right nasal probe and the proptosis of the right eye. However, the eye examination was totally unremarkable. We decided to perform the CT scan contrast. On the CT scan, the findings were the large heterogeneous enhancing lesion with internal dense amorphous densities. In the right nasal cavity, it causing the erosion of the cribriform plate and the floor of the sphenoid sinus. If we talk about the lateral wall, then it extending into the right orbit and pushing the orbit forward and causes the ptosis of the right eye. It was also causing the destruction of hard palate and the medial anterior wall of the right maxillary sinus. For intracranial, no intracranial extension was noted. However, after the baseline laboratory and radiological investigations, the biopsy of nasal mass was done. In the histopathology report, the tissue show that the stratified squamous epithelium along with the respiratory epithelium. The lobules of the spindle-shaped cells present in the myxoid matrix. Entrapped bony fragments were also noted. Findings were consistent with the chondromyxoid fibroma. The patient was operated under the general anesthesia, and the mass was excised completely under this subendoscopic sublabial approach. If we talk about the discussion, the CMF is a very rare benign tumor. It is usually involved the lower extremities, particularly the segment of the metaphysis. In the craniofacial region, it accounts less than 0.1%. So, what's the interesting in my case? In my case, it was crucial as it infiltrated the orbit, the lamina prepacia, the hard palate, but surprisingly, the tumor not compromised the vision of the patient. As the per ob, it was inseparable from the medial rectus. So the other point, as the most enhancing the in my case report, is that there is the fragments of the nodular lesions covered with the squamous epithelium and the bypass partly respiratory epithelium. So the lesions were peripherally surrounded by the fibrous cells. Another point that enhances the oddity of my case is that it involved the right nasal cavity, which involved rarely and infrequent in this region. The fourth point, that this tumor usually involved in the second and third decade, but in my case, there's a girl of 4 year old. So we decided to, after discussing with the other faculties involving the neurosurgery, plastic, orthodontics, they all were in favor of to excise the complete tumor. So after the decision were made, the complete excision was done and combined sublabial and endoscopic approach was employed. The sublabial resection should be avoided in the children, as it leads to the problem with the dentition. But in my case, as the mass was causing the complete nasal obstruction, so we are unable to pass the scope through it. Also, due to the remodeling, the medial and the anterior wall of the maxillary sinus was so thin out that access to the mass via this method was easier, provided a good exposure as compared to the endoscopic approach. Complete removal is also important, as the recurrence rate is so high, about 11.5%, but the rate of the conversion of the malignancy are very low, about 0.7%. Radiotherapy is indicated in those cases where the recurrence occur, and also the cases of the tumors of the base skull. Now, in last, the conclusion, the sinonasal chondromyxoid fibroma is a very, very uncommon and rare bone tumor, which is usually the misdiagnosed. So it is therefore important to establish the diagnosis based on the clinical, radiological, and the histological features. Thank you so much.
Thank you, Dr. Khubab. You presented a very unique case of, as you discussed, sinonasal chondromyxoid fibroma. That I think you told me it is one of the most rare tumors of head and neck region, especially the bony tumors. And you also said that it is 0.01% of all tumors, that is the bony tumors of craniofacial head and neck region. Now you tell me, what were the advantages of operating this patient sublabially and with the help of endoscope?
As you know, the patient was the girl, so we avoided the external scar, especially in this case, to avoid in this gender.
Did you follow this case up for some time? And if you followed, what were the results pertaining to the recurrence?
So after the complete excision of the mass, the patient complaint was relieved, as the patient presented in our OPD with the complaint of the right nasal obstruction and the facial swelling and the proptosis of the eye. So all of the above complaints were relieved after the 10 days post-op.
So what about nasal obstruction? Did it relieve after operating this case? And you also tell me the disfigurement.
As I said earlier, that there was an asymmetry, as you can see here, that there is a loss of the nasolabial fold and there is a proptosis and the asymmetry of the nose. So after the excision of the mass, the patient was completely relieved with the nasal obstruction, and also with the asymmetry was improved.
Thank you very much, Dr. Khubab. You presented a very unique and rare case of sinonasal chondromyxoid fibroma. Thank you very much once again.